Female pelvis. Female pelvis has a target of uterus and overfocusing. What about male pelvis? Male pelvis doesn't have any organ. It has blood, prostate, rectum. We can see that we have routine pelvis in male pelvis. If there is no doctor's pathology, we can understand that the patient has rectum problems. Then we have to plan the rectum parallel. If we have a history of prostate cancer, we can focus on the prostate. The doctor has written a list of the patients. But we have to see the history of the patient. There are many problems in the patient. There is bladder, prostate, rectum, testes. We have to focus on the patient. If there is no specific problem, we can show the entire pelvis. Then we have to plan the abdomen. It is not necessary to plan the uterus. We have to plan the uterus. We have to show the uterus. Lower abdomen. Lower abdomen and pelvis are the same. But when the problem is in the rectum, the doctor advises us to plan the entire pelvis. We are confused. We have to plan the entire pelvis. But the main focus is on the rectum. The contrast is also on the rectum. We have to plan the entire pelvis. We have to plan the cervical cancer. If there is a problem with the cervix, we have to plan it. The cervical area is connected to the cervical spine. The patient is confused. The new patients who have MRIs, they are confused. They are confused. They are confused. We need a good screening of the cervical spine. This means the same cervical spine. The word cervical comes from the cervix. The cervical cancer or cervical protocol can be written. These are the cervical protocols. The thickness of the protocol is 3 mm. Not more than 3 mm. One has 5 mm. After the contrast, dynamic contrast. I got this dynamic contrast from MRImaster.com. When I work, we do not have dynamic contrast in the pelvis. The pelvis does not need arterial, portal, venous phase. We do not need normal T1 fat set axial. T1 fat set coronal, T1 fat set sagittal. We do not need these three. We need radiology. The cervical localizer is like the previous one. We will give the plant in the form of a sagittal oblique. Plant the sagittal slices on the axial plant. Align the positioning block parallel to the endometrium. Let's see the axial image. If this is the axial image, then we will parallelize it with the endometrium. If this is the endometrium, then we will parallelize it with the endometrium. We will put the plant in the form of a sagittal oblique. The coronal plant has an appropriate angle. That is perpendicular to the cervical. This is the axial plant of the uterus. The plant is perpendicular to the cervical. We will get a beautiful image of sagittal. We will see the layers of the uterus. We will see the layers of the uterus. We will see the layers of the uterus. The layers of the uterus are black. The small field of view will be small. The small field of view will be small. The smaller the small field of view, the higher the resolution. When we read the chapter, we see that the smaller the field of view, the higher the resolution. The higher the field of view, the lower the resolution. High resolution is one thing. High resolution is another thing. When we use DSLR, the resolution is high. When we zoom in, the resolution is not high. When we use a low-cost Android phone, the resolution is not high. We see small details with comfort. We see small details with comfort. We can understand this by seeing it separately. If the field of view was larger, we would not be able to see these details. We can see the uterus clearly. Then we will plan on this image. And what is in front of the uterus? Blood pressure. Another technique I will tell you is that whenever there is a patient's MRI Pelvis, male or female, we will go to the bladder to keep the pressure on the uterus. It will be done if there is a slight pressure, so that the bladder can be seen clearly. If the bladder is empty, then the bladder is very small. So, you have seen the radiology of the bladder for a long time. Is there any problem with the bladder? Is the bladder valve okay? And the uterus can be separated from the bladder. Understood? So, we will say that if there is a lot of pressure on the uterus, then we will not lift it. Because the patient cannot stay in the machine for so long. It will take about half an hour to do the MRI. So, I ask you, can you stay half an hour? If you say yes, then there is no problem. If you say no, then I will say, okay, you go to the toilet. You come from the toilet, drink half a liter of water. Then we will say, okay, you drink half a liter of water. Then we will say, okay, you drink half a liter. Then we will give an axial plan. We will give an axial plan so that the slice is perpendicular to the cervix. And it covers the entire uterus. So, we will get an axial image like this in the cervix. Actually, the cervix and the uterus are almost the same. Actually, I didn't see it separately. This is T2 coronal oblique 3 mm field of view. This is the same as before. This is the large field of view 5 mm. We will show this field of view with the kidneys. In the plan the large field of view coronal slices on the sagittal plan and position the block parallel to the lumbar spine. That is, I will give the image of the sagittal plan and the slice will be parallel to the lumbar spine. Now, this field of view can be mapped. It can be mapped to a field of view of approximately 400 to 450 mm. And what I showed before, the cervix, this field of view will be from 200 to 300 mm. You can see the resolution of this image. Then the position block should also be checked in the other two plans. And the angle should be right. The axial plan should be parallel to the right and left hip joints. We will give the plan to the axial. The slices should be parallel to the right and left hip joints. And the slices should be covered completely from the abdomen and pelvis. And the entire abdomen and the wall should be checked. This is the plan as before. Then T1, axial, 6 mm large field of view. We will give this plan to the sagittal and coronal images. The left and right iliac crests should be parallel to the coronal images. And the sagittal images should be perpendicular to the lumbar spine. This is the optional protocol. If you want to see the radial axis, you can see it from above. Or you can cut it from above or from the kidney. Then you will need to give this. The field of view should be large enough to cover the entire pelvis. The pelvis will come and the kidney will also come. Then there is the contrast protocol. This is Dixon's sagittal dynamic. The dynamic means the first scan will be pre-contrast. We follow the technique of dynamic contrast. The liver also has a dynamic scan. When the normal scan is over, the assistant will prepare the contrast. The patient will hold the injection in his hand. The patient will hold the needle in his hand. When the nurse picks the needle, you can come inside. The nurse will tell you to stay in the room. Then we will insert the needle again. After inserting, we will start the dynamic scan. The nurse will tell you to keep your breath shut. Then we will start. After the first scan, the nurse will tell you to give the contrast. Then the first scan and the next scan will give the contrast. Then we will start the post-contrast protocol. The first scan is non-contrast. The next scan is post-contrast. Then we will do the scan one by one. The scan is not for the pelvis. It is for the upper abdomen.